Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener-supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast. "11 minutes past 8 o'clock. It is Wednesday morning, the 8th day of April, 2026. Good morning, everyone. I'm Scott Michlin. Thanks for tuning in to KSJE. 90.9 FM over the air right here in San Juan County, New Mexico. In Durango, Colorado, we broadcast at 103.3 FM. And if you're listening to my voice anywhere else on planet Earth, you've gone to our website to do that. That's ksje.com, or maybe you're listening through the KSJE radio app. It is great to have you all with us this morning. Also, welcome to our viewers. Those are the folks watching me right now. The video of this program streaming out live to the KSJE Facebook page and also to our KSJE YouTube channel. Great to have you all here, because coming up in the next few moments, we are talking about healthcare, careers in healthcare, job opportunities, and community partnerships. That's the focus of our discussion this morning, so stay tuned for that coming up in the next few moments right here on KSJE. Then later on this hour, we'll be checking in with the San Juan Symphony. It is concert weekend in Durango and Farmington. Thomas Heuser will be my guest, talking about the concert coming up at 8:50 a.m. right here on KSJE. Next hour, of course, it's all classical music, Roving with the Arts, our weekday classical music program with Mick Hess, a special 90-minute edition of Roving with the Arts on Wednesdays to take us to 10:30, and right on Four Corners, our local and regional author program with Delcherie Spinner. This week, Delcherie is speaking with the author of West Point at Gettysburg. You'll hear more about that coming up today at 10:30 on KSJE. Don't forget, you can also connect with us on other forms of social media if that's your thing, like Instagram or Blue Sky or X. And if your thing is podcasts, KSJE publishes podcasts almost each and every day. You can find new episodes wherever you listen to podcasts. And of course, they're also right there on the KSJE radio app, available now on the App Store and Google Play. A reminder, of course, of our fundraiser coming up on Saturday, May the 2nd. You can register right now and join us for the 0 Mile Fun Run. It's exactly what it sounds like, and you're training for it right now by sitting there listening to your radio. The KSJE 0 Mile Fun Run coming up on May the 2nd. You can find out more online at ksje.com/funrun. Outside our studios at San Juan College this morning, it is a mostly sunny morning, 40 degrees at the moment. We're expecting a mostly sunny day today with a high of 72 in Farmington. Clear skies tonight, the low 45. Sunny and a bit warmer tomorrow with a high of 75 on Thursday. Partly sunny and 73 on Friday. But take a look, maybe some showers developing Friday night into Saturday, Sunday, and Monday. And we'll see cooler temperatures too, with highs only in the, mid-50s by Tuesday to upper 60s on Saturday. I'll be back with my guests from San Juan Regional Medical Center right after this on KSJE. KSJE is supported by San Juan Regional Medical Center. It's physician-led and supported by specialists, so patients can receive the treatment they need right here at home. When every minute matters, dedicated caregivers are here for you. San Juan Regional Medical Center, serving the Four Corners region for generations. Find out more at sanjuanregional.com. KSJE is supported by Riverfest, New Mexico, flowing through time, May 22nd, 23rd, and 24th. Riverfest needs volunteers. You must be 16 years of age or older. Go online to sign up for one or more 2-hour shifts. Riverfest, New Mexico, flowing through time, May 22nd, 23rd, and 24th, along the Animas River in Farmington. Find out more online at riverfestnewmexico.com.
Now back to Studio A and the award-winning Scott Michlin Morning Program on KSJE.
And my guests here in the studio with me, as I mentioned, from San Juan Regional Medical Center to talk about careers in healthcare and more partnerships here in the community. Alison Zarlingo is here. She is the Workforce Development Director with San Juan Regional Medical Center. Good morning. Thank you for being here.
Good morning, Scott. Thank you so much for having us.
You bet. Also, Shelly Ackerman is here, the Talent Acquisition Manager at the hospital. Good morning to you.
Good morning, Scott.
Thank you both for coming in and talking with me about the opportunities available at the hospital. And so, Alison, let's start with you a little bit about your job of workforce development, and that is working with community partners and other organizations, I guess, right, to talk about careers and maybe try to grow your own, as it were?
Yeah, absolutely. Thank you so much. I feel like I have the dream job. I'm so grateful to be able to have the opportunity to work with San Juan Regional to help grow some of our career pathways and create sustainable health care for our community. Through that, our senior leadership team is highly invested right now in creating some programs to help build within the community, but also within our internal caregivers. So as such, that two of our community initiatives are our Grow campaign and our Homegrown campaign. Our Grow campaign is working with high schools, and also, as we're on the campus right here, with San Juan College, who's one of our wonderful partners.
Nice.
Through clinical rotation programs, internships, we do a lot of various things to help kind of provide some insight into some career pathways within our healthcare community at San Juan Regional.
Right. And I guess, too, we should say from the very beginning here, there's lots of demand for these types of individuals, for these types of jobs that we're talking about, right?
Absolutely.
And projected future demand, too, right? Not just today, but 20 years from now. I'm not getting any younger, so, so there's that.
Absolutely. As you know, San Juan Regional is one of the largest employers in our community, and we have a lot of people who want to stay within our community. So learning about career pathways within our organization is a great way to stay within our community. We know that rural healthcare is really hard to recruit for. And we want people to have the opportunity to have some insight into some ways that they can support and remain in their community.
Right. Very good. And of course, these jobs that we're talking about too are really stable jobs, well-paying jobs. You can raise a family with these salaries, these types of things that we're talking about too, and that's what makes them significant as well.
Absolutely. In fact, we talk about our Homegrown campaign all the time because we have people who start in our EVS team, who start in our entry-level positions, and through our education benefits have grown into greater careers that are sustainable for growing a family, buying a home, and remaining long-term, going into nursing careers and going all the way into physician careers. So there really is there are various ways to grow yourself within that organization.
Right, exactly. And of course, when you find people who already live here, who have maybe family connections here, that's probably maybe an easier sell than trying to bring people in from outside. I mean, certainly there are a lot of success stories there too, but growing your own locally is certainly one way to go.
Absolutely. I always joke that my husband's family homesteaded in Aztec in 1942, and so I am one of those homegrown stories of people who have come and stayed in this community and have found a way to remain in this community.
Right. Very good. Well, thank you for sharing that. I'll be back to talk to you more in just a moment, but I also want to talk to Shelly Ackerman a little bit about your job at San Juan Regional Medical Center and acquiring talent and doing maybe some of that recruiting and things like that. Talk to us a little bit about the work that you do.
Yeah, absolutely. So thanks for having us
You
here.
bet.
First of all, we're really excited to be here and just kind of share our vision of supporting this community, bringing in people who are already here, who want to be here and stay here long term. We have openings across the organization at this point, and my role is to manage our recruiting team. We have 3 recruiters and a sourcer as well that kind of reach out for our different roles. But I think the really important thing in this context is for people to understand, as Alison said, we've got roles that you can walk into today. We've got a very quick interview process. Our goal is to meet with you, talk you through what the role entails, and really get an offer to you as quickly as we possibly can. So that's I think the biggest thing that I would like to communicate.
Okay, sure, right. And so what are some of those jobs? Can you give us an example of something that like someone, maybe not me, but someone could walk in and maybe looking for an opportunity, and you can match them up and boom, bam, here they go.
Sure. So we have roles in dietary right now. We've got, which is our cafe, both front of house and back of house. If you're not a people person and you're like, nah, I don't really
Right.
want to be out front. Plenty of roles there. We've got roles in EVS, which is environmental services, and they're really our front line for safety as far as making sure that our patients are safe, helping prevent infection, those types of things.
Do I get to play with the cleaning robot? Do I get to do that if I'm one of those workers?
Absolutely.
See, there you go. Nice. Okay.
Yes, and then one of our highlight roles right now that we're really excited about is patient care techs. So our PCT role currently has a $1,500 signing bonus. So if you have graduated from a PCT certification program, you don't have to have your certificate yet. And I think that's a really important distinction
PCT,
as well.
I'm sorry.
Patient care techs.
Thank you.
Yes.
You said that already.
Yeah, absolutely. And so you don't have to
Okay.
have your certificate yet. You can earn that while you're on the job, and you don't have to have any experience in that role. And you will still be eligible to receive our $1,500 sign-on bonus. That'll come within your first 2 paychecks, and a
Nice.
career path from there as well.
Right. Very cool. And so again, that is also these opportunities. And for folks who are listening to us and saying, wow, that sounds like a cool thing, I want to find more about it. What would the next step for them be? Would it be to go to the website or call your office? What's the best path forward, I guess?
Yeah, so our website is sanjuanregional.net, and our careers page is right there up at the top. You can click on careers, and you can search by category. You can search by experience level. There's all different ways to kind of navigate the site. All of that information is right there for you, as well as our contact information. And as soon as someone applies, they will be contacted by a recruiter for that specific role, and they'll also be eligible for any like roles within the organization as
Right.
well.
Got you. And of course, as you said, right now you've got openings throughout the organization, it sounds like to us, and that's just because of the demand for in the healthcare industry, not just locally, but I think nationwide pretty much as well. So that's important. And so with your job, as you are looking for folks both locally and maybe regionally or what have you, what are some of the tools that you have? Signing bonus, I think, would probably be a good one, but are there some other things that you can offer potential employees to try to get them to maybe think about their future with San Juan Regional Medical Center?
Yeah, our signing bonuses obviously are a great tool. I think the biggest tool that we lean on is we've got incredible benefits, first of all. I think that's an important highlight, especially for this area. And longevity, as Alison said, growing our own. As we call every one of our employees at San Juan Regional caregivers. In your capacity, whatever your role is, you are offering care to our patients. You're offering a friendly face, a helping hand, maybe directions to get to where they need to go, reassurance in a time when maybe they're a little bit nervous about what they're doing. So in that role, there are plenty of ways to grow and kind of move forward in your career.
Right, understood. And so again, when you bring them on board, you want to get them working as quickly as possible, but I know there's a lot of training too in many different areas as well, and so that's also part of this onboarding process too?
Yes, training is a huge part of our process. We also have continuing education benefits, which are out of this world, frankly. I've worked for a lot of organizations in this area, and our continuing education benefits are a huge highlight. We've had multiple individuals who've worked for us for years in our EMT or paramedic programs who have used their continuing education to go on and become nurses, to get their bachelor's degrees. We also have had people who worked in our clinic settings who've moved forward to become nurse practitioners or physician's assistants. So plenty of opportunities and reimbursement for that education as well.
Nice. So it sounds like once you get your foot in the door, and maybe it's with that dietary services or other areas that maybe aren't directly related to healthcare, although everybody's a caregiver, as you mentioned, so that is kind of related. But if someone wanted to maybe get into nursing or some other types of more related healthcare fields, there's a pathway to do that, and with the hospital footing the bill, it sounds like, or at least reimbursing you for those expenses.
Yes. Yes. So
Nice.
really exciting to be able to provide that career path for people.
Right, right. Allison, I want to come back to you a little bit about some things to add to what we're talking about here, and certainly that's got to be great when you're talking to high schoolers or other folks in the area, other kids, other students, young adults, maybe who are thinking about a career in healthcare but not sure where they want to go or what they want to do, and so to be able to kind of offer some of these things has got to be a nice tool to have in your tool belt.
Yeah, absolutely. And that was such a great segue, Shelly. Thank you. So some of the things that we're working with are, and Milo, I always quote Milo McMahon on this because he said, kids can't be what they can't see. And I really love that because it really does speak to our high school programs and our internships. We do have internship programs now with our high schools where they come through and do a summer program. They can rotate now through 12 clinics to get really some visibility
Wow.
and see all the different avenues of healthcare and really kind of make a determination of what they maybe want to do when they graduate, because it's really hard to know when you're in high school what you want to be unless you have some opportunity to really see what's available.
Yeah, right.
The other piece that I think is really important is we have clinical rotation programs through our hospital. Last year we've hosted over 500 clinical rotation students across many different specialties through RNs, phlebotomy, MAs. We have physical therapy and occupational therapy rotations. We really do support students here locally, and we're uniquely positioned because we have 3 universities and three colleges within this area that really kind of funnel students in through our programs. So that's a huge, really a huge opportunity for students to be part of the healthcare system. I also want to talk about the equity piece because, as we know, that can be a huge barrier. Education costs can be a huge barrier for a lot of students. And so one thing that our leadership team is really invested in is our stipend programs. San Juan College is our stipend program participants, and they are our recipients. Last semester, we had 39 students who participated in our stipend programs, which allows them to take money every semester to help pay for their bills so that they can focus on their education. So I think the workforce development team is really providing a lot of opportunities, not only for high school students, but for college students as well.
Right. And so again, in addition to the tuition and some of the other costs that the hospital reimburses your students with, there's a stipend program that would pay for additional, I guess, expenses while someone's going to school. Is that what you're saying?
Absolutely. We know that a lot of these students have families that they're trying to support. They have bills to pay. So we don't have any requirements for that stipend program. We simply give them a check and say, if this needs to go to groceries or childcare or housing expenses, we really don't want education to be a barrier for them. We want them to be able to focus on their studies and come through and do our clinical rotations.
That's great. Very good. And I wanted to pick up, too, on some of the other things you were talking about, like those internships and being able to kind of travel around and see different areas at the hospital. And I think for high school students, I mean, I think when I was in high school, a lot of us didn't know what we wanted to do, maybe. And I think kids, young adults, again, these days are learning more and more, trying to figure out earlier and earlier a career pathway that they want to go on. And so if it's healthcare, there's so many options. It's really great to be able to go in and see kind of what to expect maybe through some of these internships is what I'm trying to say. That's the longest question I think I've ever asked somebody.
Absolutely. I'm tracking exactly, Scott, with what you're saying.
All right.
Yeah, no, absolutely. I think people, they watch a lot of healthcare TV, and we talk about this all the time to our middle schoolers and high schoolers that, we understand there's nurses and doctors, right? But San Juan Regional hospitals are an entire ecosystem, and we have all kinds of jobs. So it's really fun to provide exposure. We have mechanics, we have helicopter mechanics, we have EMS drivers, we have IT people, we have leadership positions. So anywhere that a student is interested in, we could potentially find a position that is going to grow with them, or they can work into that opportunity. So just the exposure piece alone is so valuable for students.
Right, exactly. And again, your partner is with Farmington Schools. Are there some other opportunities maybe with the other school districts as well, or is that something you'd like to explore to be able to kind of offer that to them?
We do. So we're working with Farmington Municipal Schools right now, as well as San Juan County. San Juan County right now has opened up 15 positions for our summer program. So we will have students across the region from Bloomfield, Aztec, all around the San Juan County that will be able to come in and do our summer program, which is a 9-week rotation. But then we also offer it to any students and any schools within the community that really want to come in and see what we're offering. So we do high school and middle school hospital tours. We just did one last week for a middle school. So we're open to any school that really wants to come in. We would love to support.
Right. Very good. Excellent. Thank you very much. And I want to come back to Shelly a little bit about your job again, when you're talking to local folks about the opportunities, but also maybe a little bit too about maybe folks who maybe grew up here, they moved away, and now maybe they're raising a family and thinking, wow, this urban location isn't maybe so great for raising kids, or gee, I remember my childhood in San Juan County was pretty nice and maybe we should move back. And do you get a lot of folks maybe in that category that somehow see some greener grass back here in San Juan County?
We do. That's one of the largest growing groups of new employees, new caregivers, is a group of people who maybe got a little nostalgic about their childhood here in San Juan County, who love the outdoors, who love what this area has to offer, and are looking for stable employment. As you mentioned, Scott, healthcare is a growing field, and there are growing needs in that field. So I don't want to say there's just entry-level jobs here at San Juan Regional either. We've got nurse leadership roles that are open.
Right.
We've got coordinator roles that are open. We have roles in administration that are open. And I think it's really important to highlight that if you're looking for an opportunity to really serve an organization with a mission to serve this community, San Juan Regional is the place to come.
Sure, exactly. And again, if folks grew up here and again maybe want to come back here, or maybe they got parents who are maybe getting up there and maybe want to be closer to them or closer to the grandkids or what have you, to be able to do all that, all these things kind of maybe enter into some of these decisions that families are making, and to have nice stable employment is another important part of this. So that's great to hear as well. Alison, back to you a little bit about the partnerships and things like that. Again, working with schools, but working with other groups regionally as well. Is that also part of your scope, to be able to kind of look for other partnerships outside of the immediate area?
Yeah, absolutely. I am so impressed with San Juan County specifically because we work with so many partners, the Chamber, the Economic Alliance. We are working outside now with La Plata County and the RUN program. I think primarily what we're doing is identifying some of the largest gaps we have in healthcare, and then working to build those programs to support that here locally. So Dr. Anna Greif, who recently joined San Juan College, has been a really incredible partner, and we're working to identify some gaps and some programs here that we can potentially build to support our internal caregivers' growth, but also to help build some programs to increase some of our ability to recruit and retain some of the talent that lives in this community. So yes, absolutely, we work with partners outside, but really the primary focus is to support our community for sustainable healthcare here in this region. So our regional partners here have been really fantastic to work with, and we have a lot of really invested people in this community. That's
great to hear. And again, I know that a lot of the economic development folks talk about healthcare being one of those economic drivers in this community. We know that the hospital provides regional health care, and so it has a really big footprint and able to serve residents from even across state lines and things like that. And so it makes a big impact, and it is kind of one of those things where folks come here for specific specialty medical care that they can't maybe get in their smaller communities, and so that makes it an economic driver and one of those things that can help tenfold, I would think, even more. Probably the economic folks would know what that number is, but to be able to turn some of that around and reinvest in the community, I guess, is my point.
Yeah, absolutely. As we know, rural healthcare is struggling across the nation. Really finding innovative ways to support the community and build rural healthcare programs is critical. So agreed that we have to look at partners across the region. We're looking at partners in Arizona, in Utah, people who want to support rural healthcare. So
yeah. Very good. True. Well, we're just about out of time this morning, but before we go, one final thought from each one of you about the jobs that you do and how folks can find out more about the opportunities at San Juan Regional Medical Center, and maybe consider a career in healthcare if that's not something that they've been considering before. But what would you say to those folks?
Yeah, absolutely. The best way to contact us is through our career site at sanjuanregional.net. That's our career career page. You can also reach out to me on my email. I'm happy to talk to anybody at any time. My email is amzarlingo@sjrmc.net. I'm happy to have conversations. If you're interested in having your students come through, or you're interested in talking about a program or being part of our mission, please reach out. I'm happy to talk to anybody and build more connection in this community.
Great. Very good. Thank you for being here. And Shelly, over to you. Same thing, same question.
Yeah, if you'd like more information about our benefits, about our continuing education program, and more information about the sign-on bonus that we highlighted today, please do take a look at our career site, san1regional.net, and reach on out, and we will be excited to connect you with a recruiter and then with a hiring manager.
There you go. Very good. Well, thank you both for coming in this morning and talking about the jobs that you do and the opportunities that are available for folks here in San Juan County and the partnerships that you are working on. Really appreciate it very much.
Thank you for having us, Scott.
Thanks so much, Scott.
You're very welcome. My guest this morning from San Juan Regional Medical Center with me here on KSJE. Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.